What is diabetic ketoacidosis, or DKA? Diabetic ketoacidosis is a serious complication of diabetes that occurs when the body doesn't have enough insulin. Insulin helps the body use glucose, or sugar, for energy. When there isn't enough insulin, the body starts breaking down fat for fuel instead. This process produces ketones, which are acidic chemicals. When ketones build up in the blood, they can make the blood too acidic. This is a life-threatening condition that requires immediate medical attention. DKA is more common in children with type 1 diabetes, but it can also occur in children with type 2 diabetes. Symptoms of DKA usually develop quickly and can include excessive thirst, frequent urination, nausea and vomiting, stomach pain, weakness or fatigue, confusion, fruity-smelling breath, and shortness of breath. If your child experiences any of these symptoms, it's important to seek medical attention immediately. Early recognition and treatment of DKA are essential for preventing serious complications. In this guide, we will discuss the steps involved in managing DKA in children, empowering parents and caregivers with the knowledge to act swiftly and confidently. Remember, this information is for educational purposes and should not replace the guidance of a healthcare professional. First steps: fluid resuscitation. One of the first and most important steps in treating DKA is fluid resuscitation. This involves giving the child fluids intravenously, or IV, to help rehydrate them and restore blood flow to vital organs. The initial fluid bolus is typically given over the first hour and is based on the child's weight and severity of dehydration. The type of fluid used is usually normal saline, which is essentially salt water. After the initial bolus, maintenance fluids are given at a slower rate to continue replacing fluids and electrolytes. The rate and type of maintenance fluids may be adjusted based on the child's response to treatment and electrolyte levels. Bringing blood sugar down: insulin therapy. Insulin therapy is another crucial aspect of DKA management. Insulin helps the body use glucose for energy and stops the production of ketones. In children with DKA, insulin is usually given intravenously as a continuous infusion. This allows for precise control of blood sugar levels. The initial dose of insulin is typically given as a bolus followed by a continuous infusion. The goal of insulin therapy is to lower blood sugar levels gradually, typically by 50 to 100 milligrams per deciliter per hour. Lowering blood sugar too quickly can lead to complications, so careful monitoring is essential. Balancing electrolytes. The importance of potassium. DKA can cause electrolyte imbalances, particularly with potassium. Potassium is an essential mineral that helps regulate heart rhythm, muscle function, and nerve signals. During DKA, potassium levels can fluctuate dangerously. It's important to monitor potassium levels closely and correct any imbalances promptly. If potassium levels are too low, potassium supplementation may be given intravenously. The dosage and rate of potassium administration will be determined by the child's blood potassium level and kidney function. If potassium levels are too high, treatment may involve restricting potassium intake and administering medications to help the body get rid of excess potassium. Monitoring and adjusting treatment. Throughout the management of DKA, close monitoring is crucial. This includes monitoring the child's vital signs, such as heart rate, blood pressure, and respiratory rate. Additionally, blood glucose levels are checked frequently, typically every hour initially. Electrolyte levels, particularly potassium, are also monitored closely. Based on the child's response to treatment and monitoring parameters, adjustments may be made to fluid rates, insulin doses, and electrolyte management. As the child's condition improves, the frequency of monitoring may be decreased. The goal is to gradually transition the child to a stable state where they can be safely managed outside of the intensive care unit. Transitioning to long-term management. Once blood glucose levels have stabilized and the child is no longer in a critical state, the focus shifts to transitioning to long-term diabetes management. This typically involves transitioning from intravenous insulin to subcutaneous insulin injections or an insulin pump. The healthcare team will provide education and support to the child and their family on managing diabetes at home. This includes teaching them how to monitor blood glucose levels, administer insulin, recognize and treat hypoglycemia, count carbohydrates, and follow a healthy meal plan. It's essential to continue regular follow-up appointments with the child's endocrinologist to monitor their diabetes control and make any necessary adjustments to their treatment plan. DKA is a serious condition, but with prompt and appropriate management, children can recover fully and go on to live healthy lives.